Welcome to The Explainer. Today, we're going to break down the most important treatment options for endometriosis and adenomyosis. Our goal? To give you the clear, essential info you need to feel way more confident on your healthcare journey.
So, you've gotten the diagnosis. It can be totally overwhelming, and trying to figure out what's next often feels, well, pretty confusing. Okay, let's dive right in and try to bring some clarity to the road ahead. First up, let's talk surgery. What are doctors actually trying to accomplish in there? Well, it really boils down to three main goals. One, to officially confirm the diagnosis. Two, to map out exactly where the disease is and how much of it there is. And three, the big one, to remove all the visible endometriosis they can find. Now, here's something that's really important to get straight from the start. Surgery can be an incredibly powerful tool, but it's not always a permanent fix. For some people, pain can stick around or even come back, which is exactly why understanding the type of surgery you're getting is so crucial. And that brings us to what is maybe the single most important surgical difference you need to know about: excision versus ablation. Seriously, understanding this one concept can fundamentally change the conversations you have about your treatment. So what's the deal here? Well, think of it like this. Ablation is like taking a blowtorch to the top of a weed. It gets rid of what you see on the surface, sure, but those roots, they can get left behind. Excision, on the other hand, is like getting a shovel and digging that entire weed out, root and all. And this quote just says it all, doesn't it? It's from a patient who's actually been through both types of surgery, and it perfectly captures that goal of getting to the very root of the problem, hopefully for much longer-lasting relief. And that's exactly why excision is so often called the gold standard. It's just a more thorough removal of the disease. In fact, major guidelines from big organizations like ESHRE, that's the European Society of Human Reproduction and Embryology, they suggest that surgeons really should be doing excision over ablation to give patients a better shot at pain reduction. Now, you've probably also heard the term robotic surgery thrown around. It's super important to know this isn't some robot operating all by itself. Think of it as a really advanced tool. It's a type of keyhole surgery where your surgeon is sitting at a console controlling these tiny robotic arms, which can give them an amazing view and a lot of precision. But here is the absolute key takeaway. The real question isn't robot or not. The most critical factor for a good outcome is the skill and the deep experience of your surgeon, specifically in doing meticulous excision surgery. The tool is only ever as good as the person who's using it. To be your own best advocate, you need the right tools in your toolkit. So let's load you up with some of the most important questions you can and should ask your surgeon before you agree to anything. This one is number one for sure. It gets right to the heart of their whole surgical philosophy. Their answer is going to tell you so much about their technique and whether their approach is really focused on that thorough disease removal we've been talking about. This next question is all about safety. Look, endo can be really complex, and sometimes it involves other organs. For those tricky cases, the safest care often means having a whole team of specialists, like a colorectal surgeon or a urologist, ready to jump in if needed. You want to know that plan is in place from the get-go. And finally, make sure you ask for your records. And this isn't just because you're curious. Your operative report, the photos, the lab results, all of that is a vital part of your medical history. It's absolutely essential for any future care, for getting second opinions, and just for your own peace of mind to know what they found and what they did. Okay, so surgery takes care of the physical disease, but managing this thing long-term is often a whole other chapter. So let's shift gears and start mapping out the medication side of things, which is the other huge piece of a good treatment plan. So let me be crystal clear about this. There is no single best medication. It's not a one-size-fits-all situation. The right choice for you depends entirely on what your primary goal is. Are you trying to knock down daily pain? Is heavy bleeding your biggest problem? Or is fertility your number one priority? Your goals have to drive this conversation. This table really helps break things down by what each type of medication is trying to do. You've got your regular pain relievers like NSAIDs for that in-the-moment relief. Then you have hormonal options, which aim to suppress the disease and keep it quiet long-term. There are also specific meds just for heavy bleeding. And then there's this other group for persistent pain. That's for when your nervous system has been so overwhelmed for so long that it kind of gets stuck in pain mode. So what does this look like in practice? Well, for a lot of people, the journey starts with hormonal options, like the birth control pill.
If heavy bleeding is the main problem, something like a hormonal IUS, think Mirena, can be a total game changer. But, and this is a really big but, if getting pregnant is your priority, that whole hormonal plan goes out the window because you can't use them when you're trying to conceive. And those stronger therapies, they're usually saved for when the first-line options just aren't cutting it. So after walking through the surgical map and the medication map, we get to the most important part of any treatment plan. You. It's your voice, your goals, and your priorities that matter most. So I'll leave you with this to think about. What is the number one thing you want to achieve with your treatment plan right now? Is it getting your daily pain under control so you can work and just live? Is it managing really heavy bleeding? Or is it about planning for a family? Your personal answer to that question is the key that should guide every single conversation you have with your healthcare team.